All right, we're going to go ahead and get started. As Robbie mentioned, again, if there's any questions, feel free to drop them into the Q&A portion, and at the end, we'll get an opportunity to talk about those. If you do have a question addressed to one of the speakers in particular, you can indicate that as well. That'll be helpful. Good afternoon. I'm incoming House Democratic Leader Reginald Bolding, and we are here today with an important message about COVID-19 and its impacts on Arizona. I want to thank Senate Democratic Leader Rebecca Rios and to the members of our House and Senate Democratic Caucus who are with us today. And thank you to the members of the public and media who are watching. As of today, 378,157 Arizonans have contracted COVID-19 and 6,973 Arizonans have lost their lives, leaving families and loved ones devastated. There were 12,314 new cases reported just today. Our hospital resources are quickly running out. Only 10% of our ICU capacity, which is 175 beds across the entire state, are currently available. At the same time, thousands of Arizonans are facing eviction on December 31st as a federal eviction moratorium ends, and jobless claims are rising in our state, which has the second lowest unemployment benefit in the nation at just $240 a week. And let's never forget the devastating impact the virus is having on our most vulnerable people. Less than 1% of our population are disabled people living in long-term care facilities. Yet 40% of deaths are reported in these congregate settings. They've died alone, isolated from their loved ones. We are here to call on Governor Ducey to step up and do more now, and to share a common sense legislative agenda to help build a bridge for struggling Arizonans until Congress acts on a second relief package, and when a vaccine is widely available and working. It's time to treat this pandemic less like a public relations crisis and more like the public health crisis that it is. Doing just enough to check the box is not enough. Expanding outdoor dining and hiring more nurses who may not even be available is not enough. We all want to return to normal. We all want the economy and our schools to be open. And we also want to protect our family and friends from the pandemic. Right now, our best and brightest university medical researchers could not be more clear. We are at a crisis point. And if we fail to act, there will be even worse consequences for our families and our economy. A vaccine is coming soon, and we are grateful, but too many lives will be avoidably and unnecessarily lost if we don't take stronger steps between now and the point when it is widely available, which could be many months. We all have a personal responsibility to slow the spread of the pandemic and eliminate the virus as quickly as possible. With stronger leadership and stronger steps from the top down, including a statewide mask mandate, we believe more Arizonans will accept and take that responsibility for themselves and their neighbors. Right now, that's not happening. No more mixed messages. We are averaging more than 5,000 new cases a day and dozens of deaths. And our medical personnel and resources are stressed as they were during the summer peak. Even the Capitol is now closed after several Republican members were irresponsibly exposed to Rudy Giuliani before he tested positive for COVID-19, and then removed their masks during new member orientation. Therefore, it is vital that we take an effective, fact-based approach. It's time we were no longer one of 14 states without a statewide mask mandate. It's also time to consider suspension of group athletic activities, and with the holidays approaching, stronger limits on large gatherings. We must also take stronger policy steps, from executive orders to legislation, which we will discuss today. Let's do what needs to be done now so we can return to our strong economy and normal day-to-day activities. Now I'm going to kick it over to Leader Rios to outline some of our proposals and introduce our other speakers. Senator Rios.
Good afternoon. I'm Senate Democratic Incoming Leader Rebecca Rios. Thank you, Representative Bolding, for that introduction. I want to start today with a number, 12,314. That's the number of new COVID cases today. Arizonans are struggling, and we've seen an inadequate response from the governor on slowing the spread of COVID. Meanwhile, Republicans are more focused on fake election conspiracies than they are with helping Arizona's working families through this very real pandemic. As elected leaders, it is our duty to look out and protect the people of Arizona. That is why we need to listen to the medical experts, those who are calling for immediate and more proactive measures, such as a statewide mask mandate, no gatherings of more than 25 people, and other measures. That is the only way we can hope to slow the spread. Our caucus closely matches the diversity and demographics of Arizona. We have small business owners and employees doing their best to get through this. We have doctors who are working on the front lines, and we have members who have gotten sick and lost loved ones like so many others in Arizona. Representative Teller can't be with us today because he is still in the hospital with COVID. Representative Teran can't join us because she has services for her father-in-law who passed from COVID. In the case of Representative Sierra, we very nearly lost a valued colleague and friend. Today, we have members who will share their personal stories of COVID, recovery, and the loss of loved ones. The incident causing the closure of both the House and the Senate this week also highlights the critical need to keep all of our legislative staff safe and healthy. For months, we have called for a mask mandate and guidelines at the legislature. Our Republican colleagues have refused, showing up to meetings without masks, and are now outright endangering the health and safety of our staff and the public. We need transparent and enforced COVID guidelines to keep our staff and the public safe during the upcoming session. Every day this pandemic continues, Arizonans are struggling to cope. We must streamline Arizona's overly complicated and ineffective unemployment insurance program. Tens of thousands of eligible Arizonans are receiving $117 a week, well below the $240 benefit, which is already the second lowest UI benefit in the country. Our unemployment trust is running out of funds and needs to be replenished. On top of this, up to 300,000 eligible Arizonans are now going through a new verification process to receive unemployment benefits. But many are saying the process is not working, that they have been on hold for hours with no resolutions. We need Governor Ducey to act, but this will also be a priority for legislative Democrats during the upcoming session. Our other priorities include ensuring all of Arizona's children should have access to a quality education and sustainably funded schools. Our state must uphold the entirety of its promise to provide budget stabilization for schools. Governor Ducey has a responsibility to work with education stakeholders and the legislature on a solution that provides every school the funds promised to them. We must step up to provide better protection for workers, children, teachers, and frontline workers as Arizona reopens its economy and its schools. Now I would like to introduce to you State Representative Dr. Randall Friese.
Thank you, Senator Rios. Good afternoon. I am State Representative Randy Friese from Legislative District 9 in Tucson. I'm also a physician, trauma surgeon, critical care provider at Banner University Medical Center, Tucson. I participate in the care of patients with COVID, as well as injured patients that are at high risk for COVID in both the emergency room and the intensive care unit. My colleague, State Representative Amish Shaw from LD 24 in Phoenix, is an emergency medicine physician who works in emergency rooms throughout Arizona. In fact, Dr. Shaw has been working overnight in an Arizona emergency room. Otherwise, he would be participating here today in this panel. Dr. Shaw and I work on the front lines in hospitals and emergency rooms, caring for those patients sickened by this pandemic disease. We see firsthand the suffering of each patient, the grief of their family members. We see firsthand the limits our hospitals are being pushed towards, and we are concerned. Concerned that if this surge continues unabated and unaddressed, we won't be able to provide the care our patients deserve because we will not have the resources that we need to provide it. Intensive care units will be at capacity, ventilators and dialysis machines will be limited, difficult decisions will have to be made. Is there a way to mitigate this surge and alleviate our concerns? Absolutely. Listen to the scientists, listen to the healthcare professionals and experts, listen to the hospital administrators. These professionals and scientists agree that multiple predictive models indicate Arizona is approaching a life-threatening COVID surge. Recently, healthcare leaders wrote letters to Arizona Department of Health Services Director, Dr. Chris, and Arizona mayors recommending action to mitigate the surge and flatten the curve. They indicate the swift action is necessary to prevent hospitals from reaching crisis levels and to avoid preventable deaths. Their recommendations include further limit or halt indoor dining, enforce existing local ordinances, prohibit gatherings of more than 25 people, halt group athletic activities, institute a 10 p.m. curfew, continue with wearing a face mask while in public, social distancing and hand hygiene. And finally, ensure that benchmarks that permit gradual reopenings when in the green also require closures when back in the red. The governor may not act on every single one of these on their list, but it is time to listen and lead. Strong economic recovery is dependent upon a healthy workforce and a healthy Arizona. I just want to spend a few minutes talking about the vaccine. America's scientists have quickly moved through the vaccine development process with robust federal funding and appropriate federal oversight. Governor Ducey has indicated that all Arizonans will receive the COVID vaccine free of charge. The United Kingdom has already started vaccinations, and we are not far behind. Vaccine stores have been sent to states, and states, including Arizona, are ready for distribution, vaccine delivery, and inoculation. Maricopa County has proposed 3 phases. A phase 1A, about 300,000 people, which include healthcare workers, EMTs, paramedics, as well as long-term care facility, assisted living and skilled nursing home staff and residents, beginning this month and extending into early 2021. Further in phase 1, about 1 million people would include law enforcement, teachers, high-risk individuals, those over 65, extending into the spring and summer of 2021. And then phases 2 and 3 include the general population, extending into the summer of 2021 and beyond. Remember, we are in a COVID surge. Vaccines work best in the absence of a surge. Protection will likely not be robust until the summer of 2021 or beyond. We must also ensure that distribution is equitable and that no communities are left behind like we saw in the early days of mass testing. In closing, I'd like to invite President Fan, Speaker Bowers, Dr. Christ, and Governor Ducey to visit those of us at the front lines, in the emergency rooms, hospital wards, and intensive care units. Visit the hospitals pushed to their limits to provide care, not only for patients with COVID, but those that need medical care for other emergencies like trauma, cancer, coronary artery disease, and stroke. Come give encouragement to the nurses, doctors, and bedside care providers as we work on the front lines against this surge. Come give hope to patients and their families. Please consider this: to us, to healthcare workers, it's just not about numbers and figures and graphs. These are people, these are families, these are tragedies. Act now so we can avoid the one thing that's even more tragic: a death from COVID that could be prevented. Now I'd like to bring up Senator Gonzales.
Buenas tardes. Primeramente para la prensa de habla hispana. Quiero compartir mi historia. Hace 3 días enterramos a mi hermano que se murió de COVID-19. Creemos y yo creo que no fue necesario que se muriera mi hermano. Me gustaría que toda la gente tomara este virus en serio y que usen sus máscaras cuando están fuera de su casa y con la gente y con la familia con que viven, porque este virus mata. Gracias. On behalf of the Indigenous Peoples Caucus, I want to talk a little bit about how the pandemic has disproportionately affected our indigenous communities of Arizona. Currently, on Navajo Nation, they reported on Monday that 75 of their communities are really struggling and have a big surge in with COVID, and that is out of control. As you know, the Navajo Nation is the largest nation, indigenous community in the country, and especially in the state of Arizona. They have reported that they have 17,000 more than 17,000 cases currently, and almost 700 in that community are being affected by COVID-19 at large numbers. It is part of the reason is because in some of our communities there is no running waters, no portable water for sanitation and to wash our hands. The hospitals are reporting their ICU units at almost capacity, as well as their regular beds. The San Carlos Apache tribe is also has a big surge and has a curfew, along with the Tohono O'odham in southern Arizona. They have instituted a curfew from 8 p.m. until 6 a.m. to help stop the curve. In my own tribe of the Pasquayaqui, we are a smaller nation, yet we have confirmed 30 deaths in our community. As I said earlier in Spanish, 3 days ago, we buried my brother who didn't have to die of COVID. And so I'm urging all our leaders to take this seriously. And like Dr. Friese before me said, visit the hospitals, the frontline people, and see for yourself. Governor Ducey requests mandate a mask, that everybody wear masks all the time. I'm sorry to have gotten emotional, but it is what it is. Now I'd like to pass it over to Representative Lorenzo Sierra.
Thank you very much, Senator Gonzales, and my sincerest condolences on the loss of your brother. My name is Lorenzo Sierra. I represent Legislative District 19, Avondale, Tolleson, and Southwest Phoenix. 9 weeks ago today, I was in the intensive care unit at Johns Hopkins Hospital in Baltimore, Maryland. I was there for COVID-19. I was unconscious and I was on a ventilator. 4 days after being on a ventilator, the doctors woke me up and began to ask me a series of very simple questions, including, what was my name? As they asked that, it took me a minute to remember my name. In that horrifying moment, I had forgotten who I was. And in many ways, America has forgotten who it is. We face a common enemy in the coronavirus and COVID-19, yet we fight amongst each other. We fight whether the efficacy of masks, we fight on the science of this pandemic, and it didn't have to be that way. Failure from the highest levels of leadership in America led to this division that has caused so many cases of COVID and far too many deaths. We have outpaced the entire world in the amount of deaths from COVID-19, and it did not have to be that way. In times of great struggle and in historic opportunities, America and Americans have always stepped up. Only this time we haven't, and the results show it in the number of cases and in the number of deaths. I would implore upon my colleagues, my neighbors, my friends, that in the absence of leadership at the highest levels, we must take it upon ourselves to make sure that we are wearing a mask over our noses and mouths, that we are social distancing when we can, and that we are staying home whenever possible. These are the things that we can do in this historic fight against a virus that doesn't care about our personal freedoms. The coronavirus does not care about the Constitution. The coronavirus has one purpose, and that is to destroy human cells, to make us weakened and to lose faculty over our vital organs and to cause death. That is the only purpose the coronavirus has, and we cannot see past our own differences to understand that. I would implore us to, again, follow the advice of the medical experts who have said what we need to do. And again, I thank my colleagues here on this call for sharing their stories and imploring upon our governor, our president, and ourselves to do the actions necessary to keep this virus at bay and to get back to a normal life, to get our lives back in order, to bring back. And again, I know that we are all weary. We are all weary from having to spend so much time away from family. We are weary following the cases of friends and families who have contracted the virus, and we pray every night that they're going to make it through. We are weary because we're not going to spend Christmas with the family and the loved ones that we had been planning for months. We are weary, but we are Americans. And when history hands us a challenge, we accept that challenge and we come to play. This time we're not doing it. We are fighting amongst ourselves, and now is the time. It's not a call to arms, it's a call to action. And that action is wearing a mask, social distancing, staying home when you can. Thank you, and at this time I'd like to hand it over to Representative and Senator-elect Kirsten Engel.
Thank you, Representative Sierra, and I'm so glad that you are well and that you are here to tell all of Arizona your story. I'm Kirsten Engel, State Representative and Senator-elect to Legislative District 10. In response to the rising number of COVID cases statewide, the governor is telling Arizonans to stay home when they can. And this only makes sense in the midst of a virus pandemic and it's strongly supported by public health officials. But you can only stay home if you have a home. And as of January 1st, literally thousands of Arizonans are at risk of losing their homes. As many of you know, recognizing the millions of families across America who rent their homes but yet cannot pay their rent due to being sick, caring for a sick family member, or losing their job, or just the hours at their job, the Centers for Disease Control imposed a nationwide eviction moratorium until December 31st, 2020. This has helped countless Arizonans from being evicted due to non-payment of rent. And according to the Household Plus survey by the US Census Bureau, over 23% of Arizona renters were not current on their rent between October 28th and November 9th. And that was over a month ago. But this CDC moratorium expires as of January 1st. And at that time, Arizona faces what experts are referring to as an eviction tsunami. The US Census Bureau estimates that between 44,000 and 87,000 Arizona renters are at risk of eviction as of January 1st. And the plight of renting families and communities of color are particularly alarming. Fully 56% of Arizona households with children in the home have no or only slight confidence that they will be able to pay the next month's rent. And almost 50% of African American, Hispanic, and Latino households have no or only slight confidence that they can pay next month's rent. Already hundreds of eviction actions have gone through the Arizona courts, and they're simply waiting for the lifting of the CDC moratorium to be served on tenants. And of course, as we all know, the crisis in non-payment of rent is not just a crisis to renters, but it's to our small business and large business community. Of particular concerns are those small business landlords who rely on those rental checks to stay in business and to be able to provide affordable housing to Arizonans. But almost 10% of all homeowners are not current on their mortgage payments. In light of this very dark picture, is that we actually can do something to mitigate this crisis. And we're asking today that the governor use his power to mitigate this crisis. In fact, the governor has acted to address housing insecurity caused by this pandemic, and we're asking him to do so again. First and foremost, we're asking the governor to address the immediate crisis by imposing at least a 90-day eviction moratorium starting January 1st. We admire the leadership the governor has shown in instituting an eviction moratorium last March ahead of the CDC, and such leadership is needed again to prevent overwhelming and already straining healthcare and shelter system. We also call upon the governor to replenish the COVID-19 Rental Assistance Trust Fund with at least an additional $10 million. This will provide a cushion of funds available for the potential upsurge in assistance requests that we can expect due to the expiration of the CDC moratorium. As of late November, over 30,000 households in Arizona had applied for rental assistance, but the state, through the city housing agencies, has only managed to help about 2,200 renters. Luckily, a large number of families have been helped through nonprofits at the county and city level, where their counties and cities that have used their CARES Act funds to help these renters. But we know that many, many more families are in need of this rental assistance, which goes directly to their landlord. And I know because I've talked to many of these renters that are at the end of their rope and may never have had to rely on a government assistance program before in their entire lives, but they need help now. We believe more families can be helped, and more quickly, by simplifying the state eligibility criteria for rental assistance and enabling landlords to apply directly for rental assistance on behalf of their tenants. We often forget that the population most at risk may not have internet at home, may be struggling to take care of a sick loved one. And it pains us to note that in the over 8 months that the state program has been in effect, only approximately 4.2 or 3 million has been distributed. I think we can do better. Finally, we ask that the governor replenish the Rental Property Owners Preservation Fund with additional funding as needed, and that it prioritize the distribution to small business landlords. The monies that have been deposited into this fund in the past have gone very quickly, evidence of the strong need of funds by landlords to stay in business. In conclusion, we are facing a real crisis in housing security in Arizona. We call upon the governor to use the funds and authority he has and has used in the past to mitigate this crisis and not only help renters and landlords, but to protect the health and safety of all Arizonans. Thank you, and I'll turn things back to Representative Bolding.
Thank you, Representative Engel, Senator-elect. If you have any questions, go ahead and type those questions in. I know that there is one question related to unemployment, and I'd like to ask Representative Mitzi Epstein to speak to that question with regards to unemployment. And I'd like to open up the floor to Ms. Epstein.
Thank you, Representative Bolding. I believe the question was, is unemployment getting worse in Arizona? Well, talk to people and the answer is yes. But the rates are a very good question. And so while it's true that we are at about an 8% unemployment rate in Arizona right now, that was a rise from September to October, and still above the national average by about 1%. So our unemployment rates in Arizona are serious. But more importantly, are the people behind those rates. And the fact that this really is still, I checked the charts and graphs at the Department of Labor, and we're looking at graphs that used to wiggle along like this, and now they shoot up. This is really a serious situation for us in unemployment in Arizona. I spoke with the bartender yesterday who is back to work. And that just speaks to the point that unemployment insurance works. She was on unemployment. At the first chance to get her job back, she jumped at it and went back to work. But she's now facing not very many customers. And it's just because the customers don't want to come in because of the community spread. So if we all start to do our part better, and if there were better mandates in place from our leadership in this government, then she would have much better job security. She's very worried about being able to keep her job, and she would love for customers to feel safe enough to come in and not have such horrible community spread right now. So unemployment is a serious problem, and the processing in our department is far from fantastic. In August, we had 21,000 people that it took more than a month to get their check. This is the money they earned when they lost their job through no fault of their own. And it took them over a month to get their first check. And I received far too many emails from people saying, it's been 7 months and I haven't gotten anything. And it's been that long and nobody has contacted me. It shouldn't be that way. We need action to help our working families in Arizona. And back to you, Leader Bolding.
Thank you, Representative Epstein. So there's several questions. I'm going to first start with Mr. Oxford's question. And the question is, should the legislature think about going to a different venue like the California Assembly? Do we think the Capitol has good enough capability for video conferencing? To answer that question, what we believe is that at the state Capitol, there has to be COVID protocols that are put in place that are enforced, that do a number of things. That one, protect the health and safety of staff, that protect the health and safety of members, and protect the health and safety of the public. And now there are a number of ways to do that, whether we are talking about using video conferencing, whether we're looking at different testing options. But one of the things that we absolutely do not want to do is we don't want to sacrifice public participation out of fear of safety. So what we're calling on the Speaker of the House, and we're also calling on the Senate President, is to make sure that they're taking the advice from the Democratic caucus, both House and Senate, to provide opportunities so our members, our staff, the public can participate in democracy in their government, and they also can feel safe doing that. And there's a number of ways that we can do that. And we know specifically if these things aren't enforced, where they're just words on a piece of paper. Clearly, we've seen that happen at play last week during new member orientation, in which that there was a mask requirement for those members who attended new member orientation. You saw House and Senate incoming Senate Democrat leaders who chose to wear masks. You saw staff who wore masks. But what we did not see is GOP incoming freshman members followed the protocol. Moreover, we didn't see it enforced. That's unacceptable, that's irresponsible, and that is something that will not be tolerated during this session. We cannot gamble with the lives of our members, of our staff, and those college students, those kids who are down there, whether they're pages or not, who are down there to support us. We have to make sure that we're looking out for families. God forbid that a member of our legislature brings COVID-19 home to a loved one. That's something that we can no longer, we cannot let happen. We've seen pain and suffering in many of our families. And that's something that we don't want to be the source of that at the state capitol. There's another question that we have, and this is opened up for any member here on the panel. It says, what do you all think about some of the Republican colleagues not only wearing masks, but testing positive for COVID-19 without letting the public know? Representative Kern, Senator Sonny Borrelli at a minimum, and then potentially spreading it further at the Capitol and elsewhere. So any panelists want to respond to that?
I'll jump in. I mean, clearly it's incredibly reckless and an extreme lack of concern for others. I think part of what fuels that is their continued insistence that COVID is not a big deal. I think we saw Senator Borrelli jump in and basically say, been there, done that, survived. Well, you know what, that's not the reality for a lot of folks. And so it really is, I think, again, another example of the fact that we oftentimes are working with Republican colleagues that are not taking this as serious as they should be.
And if I might just add quickly, I think we need to stop focusing on ourselves and look at how this pandemic impacts all of us. Simply because you had the great fortune or the misfortune to get the virus, but the great fortune to do well and survive, that's not what happens to everyone. And this is beyond just those that are unfortunate and get the virus and have symptoms and go in the hospital. This is also about the hospital systems that are designed to care for the emergencies that happen and the elective surgeries that need to happen and the cancer surgeries that need to happen. These things are going to be put on hold again. And, very difficult decisions are going to have to be made by hospitals and providers if we are at capacity and beyond capacity. Remember, hospitals that are saying they're at above 100% capacity already, that's because they've created beds. Pretty soon we're going to be at 120% capacity. This is not how hospitals and healthcare systems are designed to work best. This is not about you. This is about all of us, and we can do better, and we can show compassion.
Thank you, Dr. Friese. The next question, I think Representative Senator Engel may be best to address this. So with regards to food insecurity, the question is, please advise, what are some steps that we can take when we think about not only food insecurity, but also housing and things of that nature that are taking place?
Well, thank you. That's a great question, and I think it's on everybody's mind. What I'm seeing is that a lot of this is really happening at the city and the county level, and that these have been just great partners, and they have been allocating really just all of their CARES Act money to provide for these, emergency type services, whether it's housing, whether it's food security, whether it's utility assistance. That's also a big source of the funding that's going out to families in need. Is not covered by the state program right now, but it is being covered at the county and the city level, and certainly helping out emergency pantries etc. That has been a big focus. So there's just a lot of need out there, especially by our most vulnerable citizens that we may not even be hearing about. But certainly those in our cities and counties, our 211 operators, they are hearing from these people. And the need is real and it's great. And we have to make sure that the money that we are getting through, such as the CARES Act, is used appropriately to address these crises. And I guess, like many of you, I've been a bit disappointed that some of the money in the state has not been allocated to the crisis, but to other needs.
Thank you, Representative Senator-elect Engel. Well, we just have 2 more questions. I know we're running a little over time. Senator Rios, there's a question directly to you. It says, Senator Rios, when we talk about gatherings over 25, should there be any exceptions, churches, political gatherings, and what about the First Amendment?
I guess the reality of the situation is we're in a crisis state. And if everybody wants to pick and choose who they think should be exempt, then it doesn't work. This is the time for us to act and follow the guidance of the medical experts. And they are saying no gatherings over 25. This is not in perpetuity. This is short term. And we need to, as a society, take care of one another, recognize the risks involved. And if the medical experts are saying no more than 25, then that should hold to all gatherings. Again, this is, for the next month, perhaps, but we're at a crisis state. And so, yes, I think that if we're following the guidance of experts and scientists, then we need to follow what they're saying. And they're saying no more than 25 people per gathering.
Thank you. And the last question was in the chat, it asked, what are some of the proposals that Democrats have with regards to COVID-19? And we've outlined several. I know Representative Epstein, if you want to talk a little bit about UI reform quickly before we close out.
Sure. Unemployment insurance is a job maker. It has been rated so by the CBO and every organization you can find. And therefore, we have an unemployment insurance reform package that would put more money in the pockets of people, that would allow that money to stimulate the local economy. It would stop the job loss. And that's what we need to be having a very serious discussion across our entire legislature to figure out the best way to get people back to work. So we have some unemployment insurance reform bills ready.
Thank you for that, Representative Epstein. Thank you all for attending. We look forward to connecting with each and every one of you throughout these next several days and weeks as we continue to fight to ensure that COVID-19, this crisis, is something that we can absolutely beat here in the state of Arizona. Thank you all so much.